Good afternoon. Thank you, doctor, for my introduction. I am Ana. I'm from Brazil. And before I start my presentation, I need to speak a little bit about my life. Because I am a pharmacist, but I work in a dental college. And I believe completely in the holistic treatment because I'm a pharmacist and I work with medicinal plants and homeopathy. And I know that this kind of treatments works is so useful in our life. And I have in the past insomnia, and I didn't take benzodiazepinic like my patients. I don't take benzodiazepinic. I prefer acupuncture because it's really, really useful. Okay, when I finished my PhD, I received the invitation to work in a dental college. And for me, it's a kind of challenger because I'm a pharmacist, and in my master and my PhD, I work a little bit with medicinal plants. When I got the dental college, I made a map with my colleagues in a dental college, my dentist colleagues, which the main needs you have regarding pharmacology. And they said, we have something in common. Many patients come inside your clinic and they complain a lot about dry mouth. Okay, dry mouth. Why dry mouth increase this kind of side effect? Because nowadays there is this kind of disease in our society. There is depression. And depression is, according WHO, depression is the common disease and increase day by day in the world. And is the most common form of affective disorders. We can study about that, and for us, the community, the scientific community, we discuss about science, why increase depression. According to Dr. Leila, she said one morning for us, the students like a lot blog. The students like a lot website, media, Facebook. We have Facebook today. We have many kinds of social websites. And people speak with each other by mobile, by computer, but not more face-to-face. And I have some opinion about this. And many works in the psychology area said, we have too much, we get this increase, this number about depression because the lifestyle and technology helps, but sometimes disturb. And people speak, I can listen from my students, I have 1,000 friends, but you live alone in your house. I have 1,000 in Twitter, people that follow me, but you are alone in your house. I think so. It's my opinion. We have more technology, we have more hospitals, we have more medicine, more treatment, but we don't have health, at least in my point of view. Okay. Depression could be serious, and people can commit the suicide. According to WHO, the suicide in the world is 1 million deaths every day. It's too much. We need to take care about this because we discuss science. We are scientists. Scientists need to take care about this. Okay, why depression happen? At least in my point of view, and many articles, many papers discuss about depression. It's a kind of deficient some monoamines, like noradrenaline, serotonin, and dopamine. We today cannot have depression but in the future, we can. We can. Everyone can have depression during one moment in the life. For example, we can lose some people that you like a lot. We can lose some people in our family. You can lose your job, and you can become depressed. Okay, about the treatment. Now my aim is about the treatment. The adequate treatment is the drugs, psychotropic drugs, that increase the molecules, noradrenaline, serotonin, and dopamine in our brain. Okay, this medicine is involve antidepressant, antipsychotic, and anxiolytic drugs. There is two kinds of anxiolytics, benzodiazepine and barbiturics. I choose benzodiazepine because in my country, at least in Brazil and in South America, people when complain about insomnia, anxiety, depression, it's a kind of depression, people cannot sleep very well and need to take this kind of medicine. And I work with two different kinds of benzodiazepines. I work with lorazepam and I work with midazolam. Why? They are BZD, benzodiazepine, but they have different kind of mechanism. First, lorazepam, there is a long bioavailability, and midazolam is a short bioavailability. When people complain about insomnia, it's common the doctor prescribe lorazepam. For us in a dental college, midazolam is useful. Previous the treatment, for example, when people need the surgery, before the surgery, the doctor, the dentist prescribe midazolam because people became calm and more cooperative during the surgery. It's common. These drugs, psychotropic drugs in general, is common. They present many kinds of side effects. Dry mouth, it's my study, dizziness, sudorese, and intestinal constipation. Wow. Hyposalivation, my focus. Hyposalivation, xerostomia, and alterations in a saliva composition. People can complain. I have dry mouth, but the amount of saliva is normal. The name of this is xerostomia, It's a kind of subjective sensation. People has inside the mouth saliva in a good amount, but they complain. And it's common when people start this kind of treatment. At least 6 months need to recover the level, the normal level of salivary gland, saliva production. Hyposalivation. According to many studies, hyposalivation is considered when the value of salivary flow rate, the flux of saliva in the mouth, is less 0.7. When our patients start this kind of treatment and they complain, this common side effect, according to I told, dry mouth. Why this happened? Until today, nobody knows. The mechanism is not clarified. I try discover about this. In the world, there is at least 3 groups that work with dry mouth and psychotropic drugs. There is here in America, there is a group in Japan, and there is a group in Europe. And I a scientist from Brazil, start to work with this. Okay, this picture sometimes is scarce. the students doesn't like this because it's a pharmacology, pharmacodynamics, but it's important now. Because this picture, in this moment, make a connection for us why benzodiazepine produced dry mouth. Benzodiazepine works in the brain, of course, because diminish the anxiety. And benzodiazepine works in a GABA receptor. We have many, too much amount of GABA receptor in our brain. When our patient take benzodiazepine, this molecule act link with GABA receptor. This GABA receptor is in the brain, not only in the brain. God knows why, but there is GABA receptor in the stomach, there is GABA receptor in the intestine, and there is GABA receptor in the parotid gland. When the GABA receptor receives this molecule, increase the release of GABA amino acid. GABA amino acid increase the delivery of chlorette. And there is a hypopolarization. And there is no despolarization. If there is no despolarization, there is a block of neuronal cells. And there is a inhibitory effect. I think so because of that, when people take this kind of medicine, benzodiazepine, this kind of medicine works in the brain, a GABA receptor in the brain, but also works act GABA receptor in a parotid gland. One act in the GABA receptor in a parotid gland produces an inhibitory effect. I mean, there is no a good release, salivar release. Okay. Then a histomorphometric and gravimetric study can help discover about this cytotoxic effect of benzodiazepine on the salivary gland. I have two main ends. First, discover about the effect midazolam and lorazepam in a parenchyma of a parotid gland. I mean, in a tissue, na gland, in a parotid gland. And my second aim, to investigate the role of the oral-based alkaloid. This alkaloid is from pilocarpine. Not pilocarpine, jaborandus. It's common, this medicinal plant, in my country. Jaborandi, it's a kind of a tree common in South America. And you can extract this jaborandi pilocarpine. Pilocarpine is common to the treatment of glaucoma. Okay, in the world, there is no... If people complain about hyposalivation, the doctor cannot prescribe a good medicine. There is in America and in the Europe Salagen. But when people take Salagen, okay, the amount of saliva increase in the mouth. But people complain sudorese, people complain hypotension, the level of the blood pressure decrease, hypotension, and they complain about the intestinal contraction, sometimes diarrhea. Because this kind of medicine, Salagen, here in Europe and in US, is a systemic. The people take in a systemic form. I try to discover another way to apply pilocarpine, oral basis. I mean, it's a topical application. I have time? Okay. I work with animals. First, in my country, when you need to discover some new medicine, I think so in US is the same, of course. We need rules. respect some rules, we work with my patients. In this case, is my animals. After I have good results, I can apply in the human beings. Okay, I work with the Rista rats, the male Rista rats. This table shows us my study design. I work at least with the applying, administrate this kind of medicine during 2 months. I decided to work with, apply this kind of medicine 2 months in the animals because when people start this kind of treatment, delay, not insomnia, anxiety, didn't take 1 day, take at least 6 months. But this time in the world, in the life of the rats, is enough for us because 60 days in the life of the rats is like 1 month in the rats is equal 1 year in the humans. 2 months in the rats is equal 2 years. Because of that, I apply so long time. I have groups that receive saline to compare my positive control. I have group that receive pilocarpine, midazolam, and lorazepam. After the animals receive midazolam, they receive both midazolam, pilocarpine, my patent. Nowadays, I could deposit my patent. Now this formula, this medicine is a patent. And I treat the animals with the benzodiazepine plus my patent, pilocarpine. Okay, this histomorphometric works is according to this Eltor, Onofre et al. It's so difficult, this kind of study, because histomorphometric, it's a deeply study. There is too much statistician. Okay, my results. This table shows the group that receive S30 is saline, M, midazolam, L, lorazepam. N, it's mean the number of acinar cells. Why I study these acinar cells? Because if the amount of the saliva decrease in the mouth, the parotid gland didn't work. Why didn't work? Because there is too much acinar cells, or there is no, the medicine block these acinar cells. In my case, I can discover that when the animals receive benzodiazepines, the number of these acinar cells decrease. I have some study nowadays in my lab in Brazil about apoptosis. Benzodiazepine can develop a kind of apoptosis in parotid cells, in parotid gland. And salivar flow rate, of course, when saline group is normal, and when the animals receive midazolam and lorazepam, you can perceive in the table, decrease the volume. Size is the size of the parotid gland. The size of parotid gland increase, and the VC is cell volume, the volume of the parotid, and the volume of parotid increase. This table is so important for me because my hypothesis about the effect of benzodiazepine I can clarify with this table. I mean, the volume, the cell volume, the parotid gland increase because there is a hypertrophy effect of benzodiazepine. And if you have less number of acinar cells, there is apoptosis. And you have the increase the volume cell because there is a hypertrophy. It's mean for me. I think so, because when people take this kind of medicine, the parotid gland works. Parotid glands continue the production of saliva. But benzodiazepinic block the stimuli. The release of saliva is blocked. Okay. Now I need be in a hurry. The animals that receive treatment during 2 months is important for us, LP and MP, because when the animals receive my patent, the pilocarpine oral basis, we can perceive that the volume cell is almost equal the animals that receive pilocarpine. Pilocarpine is an agonist, is a cholinergic agonist. Pilocarpine works in a muscarinic receptor and increase the stimuli. Then I can, from this study, I can confirm that when people complain about dry mouth, this side effect of benzodiazepinic, produce saliva, but it didn't release saliva. And pilocarpine recover this status. Okay, this picture shows us A, it's a control group, saline, B, midazolam, and C, lorazepam. You can perceive that, I can have, but don't worry. You can perceive the organization is completely different. The parenchyma, the architecture of a parotid gland is completely different in B and C when you compare E, because E is my control group. Okay, in a hurry. This picture is my favorite because according to this magnification, I can show you that control group, psychotropic group, and psychotropic group plus pilocarpine. In this magnification, you can perceive this and this picture is there is things more similar than this group. Okay, to conclude, the chronic administration of midazolam and lorazepam proved to be able to reduce the parotid acne. Could be because of that reduce the salivary flow rate. And when you treat the animals with pilocarpine, my patent, you can reestablish the number of acinar cells and restorative salivary flow rate. Okay. It's a kind of graphic abstract. Anxiety, benzodiazepine, dry mouth, pilocarpine, increases saliva. I'd like to give thanks for this organizing committee for accepting my abstract, my work. I'd like to give thanks for God because everything in my life that I propose, I get because God stays every time with me, my institution, and this audience because listen me. Thanks.